My name is Melissa McCullen. I'm orthopedic nurse navigator here at Wayne UNC. So my area is taking care of patients who are scheduled for joint replacements, taking care of them pre and post-op. So the way that ties in with you guys is arthritis is the number one reason why we would do a joint replacement is osteoarthritis. So we're going to talk a little bit today about osteoarthritis as well as rheumatoid arthritis. So how is the volume so far? Can everybody hear me okay?
Yes, it's fine.
Okay.
But your picture is completely fuzzy.
Okay, let's see.
Muted.
Let's see here.
That's clearer. I think it might just be too far from you.
Okay.
All right, you're clearer now.
Okay. Alrighty. So in learning about arthritis, this is a perfect picture of showing someone being active, and it shows that in an active lifestyle is going to be difficult whenever you're trying to manage pain and become active. This picture demonstrates someone who in the past maybe was able to go out, take walks, walk their dog. You see him like referring to his wrist, which is a common area for pain for rheumatoid arthritis. Different forms of arthritis is very interesting. There are actually 100 types of arthritis, with the most common being the osteoarthritis. There are different kinds, such as you've heard of gout, psoriasis, or psoriatic arthritis. The rheumatoid arthritis is autoimmune. You also have juvenile arthritis. The difference is the way that what causes both of these arthritis between the two we're going to talk about today, which is the osteoarthritis and rheumatoid arthritis. But both of them cause pain, which is the pain, especially the stiffness and the swelling in our joints. This picture here shows what a normal joint would look like and the cartilage there that supports that joint. Cartilage is a film of tissue. It's softer, flexible than bone, and it has the pads that protects the long bones at the joints. And then the synovium actually refers as a membrane, and it's like a shock absorber. So it shows here how the cartilage destructs with the rheumatoid arthritis. And then it also shows the eroded cartilage, which also can cause bone spurs and osteoarthritis. Arthritis symptoms can vary, but with both of the ones that we're talking about today, both of those cause joint stiffness, swelling, inflammation, redness, and a decreased range of motion, which means your motion is limited. Whenever we're young and we're active, we're able to run and jump and don't have pain on our joints. As we get older and we develop arthritis, we are not able to move our joints as freely, so it decreases that range of motion. The osteoarthritis is caused by wear and tear of damage to the cartilage, where rheumatoid arthritis is an autoimmune disease, and it destroys the cartilage and bone, which leads to pain and also restricted movements. We also have patients to describe as like deep pain for osteoarthritis, and they also have a fear that they're going to fall. Because they feel like their knee catches or it gives way, and they're afraid that they're going to fall and not be able to do activities. So today we're going to talk about a few ways that you can take control and be the center of your care, learn more about arthritis, the symptoms, and better ways to manage your symptoms. Also, if you're a caregiver of someone who has arthritis, hopefully this will give you a better understanding as to what they're experiencing and how they feel. So maybe you can help them in other ways. Taking responsibility of a healthy lifestyle, knowing what your limitations are and knowing better ways to manage those can hopefully lead you back to a more active lifestyle that you prefer. So here's just another picture, like we mentioned, being a team captain of those that can help take care of you. You being in the center of your care, but also knowing that there are other people with you, not just family members. On your team could be your primary care provider, which would be your medical doctor that you see for your checkups, hopefully every 6 or 12 months. You have rheumatologists, which are the experts in care of arthritis. There are nurses at either your primary care or at your rheumatologist office, or you may be seeing someone at an orthopedic clinic. Physical therapists and occupational therapists are also key in helping to provide care, whether it's learning how to do proper stretches, maybe some splints and braces that occupational therapy can help you with. Occupational therapy can also help you with things around the home that can make some of the things you do a little bit more easier. If you have rheumatoid arthritis and you're having a hard time opening a jar, they can help get you certain devices to open up a jar so that you can continue to cook and do things at home that you enjoy. Dietitians are also very important because we'll learn a little bit later on by some of the things that we eat can actually cause flare-ups, but then there's also some supplements that can help with our pain. So some self-management here is better understanding the disease, which we talked about a little bit while ago. Managing pain, where daily tasks can become hard for us to do. We're used to, we would be able to vacuum and clean or then go and cook a meal. We have to pace ourselves so that we are not getting tired and worn out from some of our chores. Not being able to do things like we used to could do can cause us to become somewhat depressed. The pain can interrupt our sleep, which makes us have short-tempered. Losing that independence can be very difficult as we get older. Benefits of self-management is helping us to manage our pain and other symptoms, improving our mood and emotions. Getting enough rest and sleep is very important. That way we have a little bit more tolerance whenever we are having a lot of pain. Being physically active, eating a healthy, balanced diet, carrying out activities of daily living, and communicating effectively with our healthcare providers that are on our team, which means whenever you go to the doctor, let them know how you're feeling. And if you seem to forget whenever you go some of the things you wanted to talk to them about, make a list so that whenever you get there and maybe you're managing other problems that you have, whether it's diabetes or high blood pressure, that you're also mentioning to them about your pain and let them know the activities that are difficult for you to perform. So taking control of your pain, always keep in mind that sometimes your doctor has already prescribed you some medication to help with your pain. Make sure that you're taking the right medication that you're supposed to, as well as the way that they've prescribed for you to take it. Appropriate exercise, and that does not have to be 30 minutes a day, 4 times a week. In the beginning, make sure you're stretching, and a little bit of activity can actually help more than you realize. So even if it's just 5 minutes a day of doing some chair exercises can definitely help. Understand that your emotions play an important part in your pain perception, and also make sure you're getting enough sleep. Those two things can go hand in hand because pain can cause you to not get enough sleep. Then not getting enough sleep can also make you less tolerant whenever you're having pain throughout the day. Control your trigger events. If you have bad hip or knees, you may realize that whenever you want to be active with your grandchildren, you may not be able to go out and play basketball with them. But if you could actually go to a local area like the Y and do some water aerobics or maybe play ball with them in the water. Water aerobics are really easier on your joints than the pounding. It's playing sports outside, which would also be helpful. Eating well, good nutrition is important. We'll get into a little bit more details later on. And then making sure that you're keeping yourself comfortable. Another thing that is also helpful for your pain is managing your symptoms with heat and cold. Soothing your stiff joints would also help. There's a lot of confusion sometimes as to when to use heat and when to use cold therapy. So just keep in mind that heat helps with your circulation. It helps deliver nutrients to your joints and muscles. It's good for getting your body limber and ready for an exercise or certain activities. Your heat therapy can include some hot packs, heating pads, warm baths or showers, getting into a whirlpool or swimming pool. Um, Make sure the temperature is not too hot, and make sure you always have a barrier to protect your skin between like a heating pad and what you're using on your body. Cold therapy is good for acute pain whenever you want it to restrict your blood vessels. I will also mention to you that if you can get that swelling down, which is really good for the cool therapy, that will decrease your inflammation, will also decrease your pain. Because if that joint is inflamed, it's going to swell. Cooling packs will also decrease that swelling, which will decrease your pain. And the cooling also numbs the nerve endings. Move your body about. Yoga is also helpful to keep in mind. So back to your emotional health, these two are linked. So if you are having a hard time managing your pain, it's going to be difficult for you. You're not going to want to leave the house to go out and run errands or do something fun with your friends, which can also lead to more isolation. I know right now we are all in the middle of the pandemic, so we're not going out and about a whole lot either. So just making sure that you are engaging in these times that you can get out and about will also be helpful, just because emotional and physical symptoms can be linked, making sure that you're not getting overly tired and making sure you're getting plenty of rest. There's always a work and leisure balance. If you have an autoimmune disease such as rheumatoid arthritis, your immune system will attack your body and inflammation is the result. The body undergoes stress and tries to cope, and it releases more inflammatory products into the blood. This can cause fatigue, especially whenever the disease activity is high or low-grade inflammation takes place for a long time. So there is that vicious cycle between pain and fatigue. Being fatigued can also make your pain worse and make it more difficult to manage your arthritis. Make sure you're aware of things that cause your pain. Pace yourself. Make sure that you plan in advance. Think about how an activity will affect and develop a plan to get you through it without causing a flare-up. And be realistic. Know what you can and cannot do, but always be kind to yourself, and try not to expect too much too soon as you try to add in some exercise and incorporate some activities. Some benefits in being active. Sometimes activity can cause a flare-up, but this is just some examples of some activities that can help you in small increments. Walking, dancing, playing golf, swimming is really good as far as being in that water because it helps with your muscles and your joints, and it can also serve as some therapy as well. Gardening, weightlifting can improve some of your strength, but I would recommend the lowest of your hand weights. But always, before starting a new activity, make sure you've cleared it with your primary care provider. Do not start a new exercise regimen or activity like this without first getting cleared from your primary care before proceeding. There are water aerobics, yoga is good, and then some basic chair exercises will also help you. Staying flexible, sitting in a chair, raising your arms or your knees, getting in and out of a chair or lifting weights 2 or 3 sets per week and repetitions of 5 or even 10. You may have some soreness at first, but you should not have any joint pain from that. Walking or low impact aerobic activity, your heart rate will go up and your breathing will increase. This activity for 5 minutes straight and build a longer duration, up to 3 to eventually 5 days a week. Doing any activity for even 5 minutes is better than not doing any activity at all, but always make sure that you know your limits, and if you start to do something and it causes you pain, then definitely stop. Professional physical advice, As always, resources and programs are available through the Arthritis Foundation, fitness centers, YMCA. Some local hospitals also have some physical activities that are scheduled for the communities. If you need help getting started, physical therapist is a great place to start. They can help you develop an exercise program that is modified for your needs. And occupational therapies can also help you identify ways to help you around the house. Arthritis Foundation or CDC will help you with being physically active as well. Now to eating healthy can reduce your arthritis symptoms. Another thing is to mention is being overweight puts extra stress on your joints. This is again like a vicious cycle. We want patients to maintain a healthy weight to keep that extra pressure off of your joints. But if you are having joint pain, you may not feel like you can get out and about and do some exercises. So just keep in mind incorporating some exercise each day slowly and then build up your endurance will help. For every pound you lose, it takes 4 pounds off of your joints. And I know that really sounds like a huge impact, and it sounds like it would be the other way around, but it is not. So for every 1 pound you lose, that's 4 off of your joints. So just think if you are 5 pounds overweight, that's 20 pounds that would relieve your knees right there alone, and that may help some of your pain symptoms as well. There is not a diet that can cure arthritis, but what you eat can also affect your joints. A great resource for you to go to if you have online access is choosemyplate.gov, which is choosemyplate.gov, myplate.gov, and that will help you build healthy meals. Following a diet that's low in processed food and eating more fruits and vegetables is also very beneficial to you. Staying healthy overall can help decrease your symptoms. If you're eating processed food, it's going to have a lot of sodium. Sodium will also cause you to retain fluid. So if you're already having issues with your joint swelling, that can also make you swell more onto your joints, which then will cause you to have additional pain. If you're on steroids and have an increased appetite, just make sure you have quality snacks available. A lot of patients have been on steroids to help them with their joint pain. That is very common. Make sure that you have healthy snacks such as higher fiber, low calorie, to help satisfy your appetite without overeating. For those with suppressed appetite, liquid options such as smoothies and Greek yogurt, fruits and vegetables can also help you with calories without making you feel too full. So best strategy is to include small meals every 3 to 4 hours and to consume plenty of fluids between meals and maintain hydration and to try to avoid overeating. So here's just another example of your healthy eating with your arthritis. Omega-rich foods. Cold water fatty fish such as your salmon, your tuna, sardines, and mackerel. Your fruits and vegetables are definitely helpful to you. Whole grains provide sources of fiber, which may help lower pro-inflammatory markers in the plasma. Some spices that patients have found helpful are turmeric and ginger. Supplements can actually help reduce some of the inflammation and pain you're feeling in your body. But also keep in mind there is not a cure to arthritis, unfortunately, but what we put into our body can actually cause it to feel worse or actually help. And here's just another example of some processed foods that we need to avoid. If you want to start eliminating some of these foods in your diet and see how you feel, you can take out some of these foods for like 1 month and see. Just because processed food, alcoholic beverages can exacerbate some of our symptoms that we feel with our pain. And like I said a while ago, these processed foods can make our swelling worse, which leads to more pain. Before starting anything additional, as far as like the supplements, also keep in mind consult your doctor. This is just a reminder. Supplements may interact with some of the medications you're already on. And if you have bone-on-bone pain from like osteoarthritis, it is not going to ease that. It may help with some of your pain. It may lower your blood pressure and it may reduce inflammation. But if your knee pain is strictly bone on bone, it may be to a point that some of these supplements will not help you. But always consult with your doctor before starting anything new, just to make sure it won't interact with any of your medications, and to make sure in case you need to space some of these out. Alternative treatments, there's a lot of times that alternative treatments are a good idea. Also mention these to your doctor. There may be things that you may or may not have already thought about. Sometimes electrical nerve stimulations for pain, aromatherapy for arthritis relief, magnets and copper have not been found to ease rheumatoid arthritis symptoms, but possibly osteoarthritis. It has. The natural treatments, of course, the supplements that we talked about a while ago. Make sure you discuss these with your doctor, and then they can refer you to someone that they've used before that is a trusted source. Make sure you're staying vigilant on this and be mindful. Some things may be a gimmick, so just make sure that it is evidence-based. Make sure there are scientific studies to prove it and that it's from a good quality source. Like I said, this is a great time that you would refer to your doctor and ask him if there's someone they recommend or a product that they have seen that they have good feedback. Because a lot of times whenever they refer out, patients will come back and let them know what works and what does not work. Would help you with some time and money. Helping those around you to understand, it's very important to keep your family involved and let them know, hey, this is what I'm dealing with. This is what it feels like. Let them know what activities help and what activities actually hurt. Ask your friends for support. In the workplace, if you're still in work, talk to them about a different office chair, a different setup at your desk. If you're having a hard time sitting there for a couple of hours throughout the day without going into some pain. They have pens and pencils. They have bigger grips on those if you're suffering from rheumatoid arthritis. Make sure that you're trying to move and stretch. Sometimes if you find like you don't have good family support, your doctor may recommend that you talk to a counselor to get someone that you can talk to so that you're not tunneling this frustration in and carrying it on your own. Plan ahead is a very good idea. If when you wake up first thing in the morning and you feel like you're stiff and you need to work out your muscles and your joints and before you can go into activities, then plan your errands later in the day. Plan ahead, start later. If you go to the movies, get a seat that's at the very end of the aisle so that you can stretch your legs and it's easier for you to get up and down in case you have to get up and move about. You and your healthcare provider, here is just a reminder of different ones that can help you with your team. Take your medications as prescribed. Take home messages here, just showing you here that you are in the center of your healthcare team. There's a lot of people around you that can assist you. Again, occupational therapy, physical therapy, your family, doctors, nurses, a rheumatologist, orthopedics. But always remember you are in the center of your care. Keep your emotions intact. Try to get some rest because like we mentioned earlier, that pain and fatigue, they go hand in hand. It can become a vicious cycle. Eating healthy, staying active, whether it's water aerobics, doing some gardening, but just make sure that you are pacing yourself and contacting your doctor prior to starting anything new. Before we go into questions, I just want to make sure that we thank the United States Bone and Joint Initiative, experts in arthritis and advisory committee for letting us use their documents on this presentation for arthritis. And if you want to contact Rebecca. You can let her know if you have any questions. If you're having a hard time as far as the technology piece of this, if you want to email her some questions and we can follow up, and let us know what your concerns with arthritis are, and the things that you may have learned from this session, or you want to, something that you've tried and you want to talk to the group about, let us know what's working for you. Just feel free.
Is there anyone in the group that has questions for Melissa now? Okay, well, if there's no questions at this time, then we're just gonna go ahead and let Melissa go. Thank you for doing this for us. And this will be re-aired as long as the recording turns out. And again, if you guys have any questions, you can email me wellness@broadme.org or call me on my extension 8062, and I can take care of getting those to Melissa for you. Okay?
Alrighty. Thank you.
Thank you for your help.
Rebecca,
Yes.
you know, I could not get through to this meeting with the link on Care Merge.
Okay.
It wouldn't open it. I had to get in through Zoom.
I had, for whatever reason, I had to copy, like I had to highlight it, and then when I clicked to copy it, it gave me the option to open within Zoom. So I don't know why.
Well, I think that's probably why you haven't gotten more people.
So
I had the same problem and then had to go in and
Yeah.
I have something else to say.
sure.
Her picture, her screen was tilted so you couldn't see her mouth. It was so dark I couldn't see. I tend to rely on lip reading, and so I couldn't understand what she was talking about.
Okay.
Okay. So that might not even help with the recording then.
No, I doubt it.
Yeah.
I actually left in the middle and went to the TV, and that didn't work either.
Yeah. Okay. I did the same thing. Yeah.
That's good feedback that I can give her, because they, her IT people, wherever she's out of, gave her a different setup this week. So she said any feedback would be helpful for her going forwards. So
Yeah, she should also have, I mean, if she's going to be doing this quite often, she should also have a camera that has a light on it.
okay.
Like that's what I have. Let me show you. And it now you can read my lips perfectly.
Right.
You know. So I think that's some of the considerations that she should make.
Yeah, definitely. I'll give her all that feedback.
Okay.
Yeah,
Any
I
feedback,
agree.
good feedback.
Yeah.
I also have a comment. This is Del Sweeney. It would have been helpful if some of her slides had text on them rather than all of them being cartoons, because I found her a little difficult to understand. And I would have been able to follow along a little better if it had been a more classic PowerPoint presentation.
Yeah. Yeah, I agree.
Kind of like subtitles almost.
Mm-hmm. Something. Okay, well, thank you anyway.
Yeah.
Anytime.